Hi everyone, I'm Trisha Gibson coming to you from my home office at Connective Clinical Counseling. I thought I would come to you today to share 4 things that I get asked most often about counseling. So the first question is, what are the common problems which clients come to you for every day? So I would say most often I see patients with depression, anxiety, and trauma or PTSD. There's a myth about PTSD that usually only veterans in combat are people that get PTSD, but that's not necessarily true. Trauma occurs anytime that we have a life-threatening or perceived to be life-threatening event happen. So in my practice, I've seen patients that have been victims of sexual assault or rape, domestic violence, people that's been in car accidents, people that's had family or friends complete suicide. So those are definitely some things that focuses of clinical attention. Depression and anxiety, those are things that are more common. We all experience depression or anxiety and at some point in our life. Depression's where we're feeling sad, depressed, hopeless, helpless, difficulty sleeping, loss of motivation, so we're not feeling like doing things that we need to accomplish on a daily basis. Anxiety, on the other hand, is where we're feeling nervous, anxious, or on edge, having trouble sleeping. We might have some irritability or anger, some muscle tension. Panic is kind of on the more severe side. So anxiety can be general or it can be specific. There can be a specific phobia. So those are things that I treat in clinical practice using cognitive behavior therapy or using an intervention called EMDR that I'm trained in. EMDR stands for eye movement desensitization and reprocessing, and there's a lot of research that says it's the best practice to use for trauma treatment. It's also effective in treating depression and anxiety. So those are 2 things that I do offer in my clinical practice. Second question is, what pieces of advice do you find yourself offering clients most often? So there's quite a few things that I use. I would say the top ones are, think about what you're thinking about. And that sounds so easy, but it's so difficult at the same time, especially when we're having thoughts where we're feeling so overwhelmed. Like there's just so much going on in our mind that we have trouble sorting it out. So thinking about what you're thinking about helps us to be able to identify what the problem actually is that's leading to depression or anxiety or whatever other type of feelings that you're having. So the whole idea behind cognitive behavior therapy is your thoughts is what leads to feelings. So if we can learn how to know what we're thinking about, learn how to challenge it or change focus, we change how we feel as a result. And so that's my job as a therapist, to help my patients navigate that process and help them learn how to challenge or refocus those thoughts to improve their overall mood and functioning. The other thing I think I would want patients to know is you're not your problems. You are separate from what's going on around you. And so it can be helpful to recognize, I'm not depression or I'm not anxiety, I'm not these thoughts. These are things that come and go. And through counseling, we can work on that a bit more as well. Third question. When you meet clients for the first time, what questions do they usually ask? So this is a good question. I think one of the main questions I get asked is this confidential? Yes. Everything you say with me in therapy is confidential. I don't share your information with anybody unless you sign a release for a certain person. Even then, it's only as need to know. There are some exceptions that I do have to report if someone's in danger. So if a patient's suicidal or wanting to hurt someone, or if there's a situation where someone's disclosing a child's being abused, I have to report that for safety reasons. But otherwise, everything you say with me stays with me. I don't share your information with anybody. So there's no worries about a spouse or friends or family finding out what you're talking about in therapy. The other question is, do you accept insurance? Yes. There are some panels that I am in network with. So UMR, United Healthcare, Optum, Blue Cross Blue Shield, Medical Mutual of Ohio. Those are all ones that I'm in network with currently, and I'm in the process of paneling with other insurance panels to be able to be in network. If I didn't list your insurance, that's okay, or if you don't have insurance, that's okay. Still contact me because there are options and I can help you figure out what would be best for you. Last question is, when you meet clients for the first time, what don't they usually know that you wish they already knew? So this is also a good question. I think first and foremost, I want people in general, not just potential patients, to know mental health is okay. Like, there's such a stigma surrounding mental and emotional health. And I want people to know that feelings are normal. Like, we all have feelings. And there's nothing wrong with someone that's wanting to seek counseling. It's actually a strength that you want to work on yourself, your mental, emotional well-being. There's a lot of research that says mental well-being plays a role in your physical health as well. So if someone broke their arm and goes to the emergency department for treatment, no one questions that. But if someone's coming to counseling, there's a stigma surrounding it that something's wrong with them, but that's not the case. Not at all. It's just that psychological issues or injuries are things that can't be seen. And so I think there's still a mystery surrounding that. Counseling's for everyone, not just people with severe mental illness. It can benefit anybody. So I would want people to know that first and foremost. Secondly, I wish people knew that counseling is not just about me giving advice. Counseling is where I view patients as the expert. And that might sound odd because, yeah, I have a master's degree in professional counseling, but the patients are the expert because they live their life. I don't. They know themselves better than anybody. So I rely on my patients to tell me what's going on, what they're thinking, how they're feeling. But at the same time, they can rely on me to bring my clinical expertise and experience to the process. So counseling overall is collaborative. I walk beside my patient through their pain and am a resource to help them find their own answers. And it's a partnership, and we work together. So overall, those are the 4 most common questions in counseling. If you would like to learn more about connective clinical counseling or learn how to make an appointment, you can contact me through email, counseling@connectiveclinical.sprucecare.com, or give me a call at my office, which is 740-247-5463. Thank you.